Hi everyone. Today I would like to invite a very dear friend of mine, Anke. She's a German naturopath and a Jinjin practitioner here in Singapore. I was very lucky to have met her in my first few months here, as she's such a powerhouse of knowledge. Her quest for natural healing and her passion on it can help inspire most of us. But most of all, she's a wonderful person inside out, and I'm so happy she's agreed to do this interview with me. So welcome, Anke. What is naturopathy and how does it differ from homeopathy? Because in India, we have more of homeopathy than we see naturopaths. So if you could give us a little bit of an understanding on what you all do.
Good morning, Rukshin. Thank you so much for the invitation. I really appreciate it, and I love being here. Same, likewise, lovely to meet you a few months ago, and always happy to share with fellow practitioners. Now, naturopathy, in German, we would call them Heilpraktiker, basically holistic natural medicine doctors who may use a variety of modalities, anything from botanical medicine, bioenergetic work, using supplements, using diet, using even manipulations like osteopathy. Many are also trained in homeopathy. So in Germany, it's more like an overarching term for people who use evidence-based natural medicine. The goal is usually to allow the body to heal itself, go to the cause, maybe even find the root causes, which may often be based on lifestyle, emotional issues, or faulty medicine, infections. So it's an approach of going very much into the core of what's going on with the person and helping them to heal themselves. We often see ourselves more as teachers rather than the one who has all the answers. The goal should be to involve the person as much as possible to take ownership of their own healing. So if somebody comes to me and says, hey, I've got this, fix me, we have to work on the whole attitude. I think you may know what I'm talking about. So health is not about somebody else fixing me, but it's really very much about reevaluating my own life and what has led to the discomfort that I'm in at this point. So yeah, so we use all those different tools. Different naturopaths may have different things in their toolkit. As you know, I also practice Jinjin, which is another modality that works very much in a similar way as acupuncture and TCM with the same energy pathways, but is a non-invasive method. So we just use hands on the body to unblock the energy channels that may have gotten stuck due to fear, anxiety, all kinds of emotional problems, and just lifestyle. So that is a modality that I use quite a bit on top of the other things that I do. And I find it very useful because it gives me a chance to, through pulse listening, similar to Ayurvedic or TCM doctors, to see what is going on at the deeper levels and what may be the underlying energetic issues with the person in front of me. Jinjin is a Japanese name, means the art of the creator through the compassionate man. However, the person who reassembled it in Japan, because it's actually very old, they thought that it may have reached Japan through oral tradition from India, via Buddhist monks. It's actually really quite old, even older than acupuncture. And I love it because it's a very powerful methodology, which you can also teach to your clients. So whoever I see, I also like to teach them some self-help so that they can take part.
Your understanding of what immunity is, what do you feel helps someone have a good, highly functioning immune system? And what do you think inhibits that?
Okay, being an energy practitioner, I think energy trumps all. So that I think that the very first factor would really be reducing stress and getting the decent sleep. Because most of the, like probably 50 to 60% of issues will improve with this, maybe even higher than that. Then, of course, if you have underlying health conditions, those have to be addressed. So if people have hypertension, they have autoimmune problems and so on, you need to be treated for those issues so that your immune system can function properly. A very common problem is nutritional deficiencies or poor diet. So if you overconsume sugar, if you eat a lot of junk food, your immune system is not going to work very well. Why is that? Because your body is going to be overloaded trying to break down all this rubbish, and B, because you're going to be deficient on major nutrients that your immune system needs to function. So just one session of gorging yourself on excess sugar depletes your vitamin C in the body. Vitamin C is one of the major nutrients you need so that your immune system can function. Another example is zinc. A poor nutrient-deprived diet will leave you short on zinc. And zinc is one of the absolute key nutrients that you must have so that your immune system can work. So sleep hygiene, mental health, decreasing stress, proper nutrition, very important. Then at the next level, after you have done those things, you could look into immune modulators, herbs, but then it's very individual. So I wouldn't randomly go out and tell everybody, hey, take a bunch of elderberry, take a bunch of echinacea or astragalus, funghi, or the equivalent Ayurvedic herbs, because I would really much rather have that person have a proper diagnosis and check whether those things are actually suitable, because not everybody is the same. Everything is very much bio-individual. The basics like sleep, food, mental health, and so on, yes, you can give general advice, but when it comes to actually supplementing and using herbs are very powerful medicines. You don't want to give blanket prescriptions for these things. And I don't think it's a great idea. Same as with homeopathy. Homeopathy is obviously even much more precise with your case taking, and until you find the one remedy or the two remedies. And in herbal remedies, it may not be quite as extreme, but still not everybody responds in the same way to medicines. Some people will have an allergic reaction to echinacea. Some people become ill from ashwagandha. So don't go there. Don't go and raid the supplement cabinet. So talk to your practitioner before you go and do these things.
Now I want to get into a little bit of a specific aspect of hormonal disorders, and especially focus on thyroid disorders, because I know that these conditions are on the rise. Every year we're seeing more and more cases coming in. And what would be your understanding of thyroid disorders? Why do you feel we're seeing so many increased numbers day by day? And how do you, in your knowledge, best treat these conditions?
Yeah, thank you. So thyroid is obviously a huge issue these days. And as you rightly said, I mean, we all see so many more clients coming in on a daily basis, especially women over 40 who have thyroid issues or who suspect, or they don't know, but they come in with the symptoms, and sometimes they're really glaringly obvious. So what is the thyroid, first of all? So it's an endocrine gland that sits at the base of your neck, in front of the neck. And it's basically something like, you could call it the thermostat of the body, which produces life-giving hormones, which basically induce the energy production in the cell. So if anything goes wrong in that process of either producing the hormones or converting them to the usable form in the cell, then we end up with a host of issues, from fatigue to weight gain to depression, hair loss, you name it. There's so many thyroid problems that people may have, because basically it affects every single organ and cell in the body. So most doctors, so if you're lucky enough to get a diagnosis, many doctors will only test very basic things and tell you, hey, everything's okay, because they're, first of all, their lab ranges may not be the functional lab ranges. Functional meaning giving you optimal health versus just surviving. If you have a proper diagnosis, then their next challenge is, what do you do? How do you treat it? So I would say the thyroid, in many cases, is like the light on the dashboard. It shows you, hey, something's going wrong. Now, you wouldn't go and just tape over it or rip it out or something, or just, if you give one medicine, which is in many cases just a synthetic levothyroxine, you may bridge the gap for a little bit, assuming that this levothyroxine is actually converted to the usable form in the body, which is often not. But you haven't looked at the cause. So what could be the reason for this rampant epidemic of hypothyroidism today? So there are a multitude of causes. Stress is again number one, I would say. I've seen people who have gone into autoimmune thyroiditis just from overload of stress. your cortisol starts, your body starts pumping out an excess of stress hormones. That alone can give you an inflammatory cascade in the body, which can cause leaky gut, can cause deficiencies, can cause malabsorption. Your thyroid needs you to be well nourished and needs other hormones to function as well, including your sex hormones and adrenal hormones. So stress is one very basic factor. Nutrient deficiencies are enormous. I very often see women come in, unfortunately, I must say, many vegetarian Indian ladies who eat, like say, they have zero non-veg in their diet. They're very anemic, eat a lot of bread, cooked foods, and they're low on minerals from iron to zinc to selenium and so on. So any one of those is a bottleneck. If you're anemic, that alone can make your thyroid malfunction. So you've got to get those levels up. Hormonal birth control is a very big one. Many women go into hypothyroidism from birth control pills or after discontinuing them because they block up the progesterone receptors, and they also leave you nutrient deficient. So birth control pills can make you low in B vitamins, that can make you low in nutrients that you need for your thyroid to function properly. So that's something that takes a little bit longer to fix because you have to detox them and then build up their hormone levels again. Sex hormones are also a key factor in perimenopausal women. Perimenopause being the phase in a woman's life, could be 10 to even 15 years before menopause, where initially your progesterone levels drop and then later estrogen drops, creating a gap between estrogen and progesterone. So progesterone actually boosts your thyroid, whereas an estrogen dominance, even a relative one, can suppress it to some extent. Okay, there's more interactions with the adrenals and so on, so I can't go into that, but this is one reason why women over 40, typically you see that their thyroid hormone levels drop. Leaky gut is another factor. So that's become like a flashword out there, but what is it really? So it's really a state of inflammation in your gut, which causes the lining to become permeable. So reasons could be anything from parasites, infections, low zinc levels, which you often see in people with poor nutritional status, Candida overgrowth from excessive carbohydrate consumption and so on. Stress alone can also lead to the gut becoming permeable. So then what happens is you get an autoimmune reaction in the body. And very often the thyroid is also one of the targets of this autoimmune cascade. So you need to fix the gut. Actually, in almost everybody, you have to look at gut because absorption and nutrition is so vital. If you're eating things, you're not absorbing them, you're setting yourself up for chronic issues. Stomach is also a thing because if you're low thyroid and your gut, your stomach health suffers, you start producing less stomach acid, and then becomes a vicious cycle of malabsorption and poor energy and poor thyroid. So you've got to put in a stop somewhere, put in the nutrients to fix it, and then hopefully the system will pick up again. Toxins, I think, are a huge issue as well. Sometimes difficult to trace, to see what we have been exposed to, but the endocrine glands are like a sponge for toxins. And whether it is heavy metals or toxins from plastics that we consume on a daily basis. Halogens are another problem, a big problem, because halogens are on the periodic table, all the way on the right-hand side. You're talking about chlorine, bromine, and fluorine. Those have the capacity, if they are more aggressive than iodine, they can displace iodine from your thyroid gland. Thyroid hormone are built around iodine. So your thyroid hormone T4 has 4 iodine atoms, T3 has 3, and T2 has 2, and so on. We need iodine for our thyroid to work, but also for every cell in the body, and especially for the reproductive organs. So if we're exposed to a lot of other halogens, including fluorine and chlorine, we have the risk of displacing iodine from the gland. So let's say chlorinated drinking water, fluoridated toothpaste, or even people putting fluoride on teeth. Those could be risk factors. So I would have always advised for people to filter their drinking water or to drink spring water if they can, to basically reduce this exposure. There have been studies in the UK done by GPs who saw that in their areas that were fluoridated, the incidence of thyroid disease was much higher. Okay, but that's just one thing of the, you know, you go down the rabbit hole of toxicity and drive yourself nuts. But go after the main things that you can control. Infections, I would say, are another big issue because many people are infected or they have underlying viral issues, whether it's Epstein-Barr or other viruses. And in Singapore especially, there's a lot of mycoplasma going around. I'm convinced that mycoplasma can be a factor in Hashimoto's and autoimmune thyroiditis. So my daughter basically developed Hashimoto's after her first mycoplasma infection. And I discussed with her endocrinologist, who was also pretty convinced that this could have been a triggering factor. It's hard to see these things because many of these pathogens, they just go deep into the body until you can't sometimes even show them in the blood anymore. You can't see it, but it's there in your endocrine glands. It's there in your nervous system somewhere. So those things are difficult to eradicate. Having a healthy immune system, healthy diet will do a lot to keep those things at bay. But sometimes you need to go deeper. And that's where like, homeopathy can come in. I think we can do a great job at helping to eradicate those deeper lying infections. In Germany, we have a modality which is called IST. I forgot what it stands for, but basically they work with nosodes as well. So it's an energetic way to find out which infections are still present and may not be measured in the blood, and eradicating those layer by layer, because oftentimes you have not only one but multiple chronic things going on. Genetics can play a role. I forgot one thing, mold is another big issue. Try to keep your whole house as mold-free as possible. Singapore is obviously a place where it's super humid, and if you don't pay attention to keeping your place well ventilated, you may end up with a lot of toxic mold. And that's one major thing I've seen in people, chronic stuff and also with chronic thyroid issues. And it may also be one reason why there are people who move to Singapore or a tropical country and they feel a lot worse here. But as soon as they go back to, let's say, a drier place, they may feel a lot better. So those environmental factors are definitely there. Yeah. Genetics can play a role, sometimes runs in families, but the genetics may also just mean that you have a susceptibility, that maybe you were already born with some nutrient deficiencies, or you were born with some blueprint of your family. Doesn't mean that you can't work on it. So many people say, hey, it runs in the family, but what you eat may also run in the family, or what you think may also run in the family. Or if you come from a particular area that has soils that are deficient in certain nutrients, that can also be a cause. Yeah. So in short, how to find the cause. You can bridge with hormones if it's necessary, but it won't usually fix the cause. Many people find that they can actually reverse thyroid issues if they work on those reasons why they have it in the first place. Of course, the sooner the better. If you leave it for 20 years, often the gland will atrophy, and then you really are going to be dependent on hormones for life.
And I remember last time you were mentioning that there is a natural form of the hormone.
There are several different forms of thyroid medications. So the standard allopathic medication is the synthetic levothyroxine, which is a bioidentical form of the hormone T4, which is actually a pro-hormone, which then needs to be converted into T3. So the T3 enters the cells and basically stimulates the mitochondria to make energy. Now, the breakdown of T4 to T3 it's a process that needs some catalysts. And also it happens in the periphery. So it happens in the thyroid to some extent, but also in the organs, in the gut, in the liver, and the kidneys, depending on requests. Basically, it's an on-request process. There may be many reasons why this process doesn't work. So if you're already sick, it's unlikely that all these organs function, that these processes function well enough. Then you need a whole host of nutrients for this process to work. You're deficient in iron and zinc and iodine, magnesium, manganese. Any bottlenecks can cause this process to slow down. Stress can also slow it down because your body says, hey, let's go into energy conservation mode. So again, you have that catch-22. Your body actually wants to rest for whatever reason, and you're telling it, hey, here's a bunch of hormones, wake up. So it has very many clever processes then to stop that from happening. So you may produce T3, but the body says, hey, this is too much energy for me. I'll make it into RT3, reverse T3, which is basically a mirror image, but not functioning of that T3 hormone. So coming back to the medication. So if your T4 conversion isn't working, that you can see that on your thyroid labs. And if you go to the doctor, you must ask for full thyroid lab values. So TSH, which isn't even a thyroid, but pituitary hormone, free T3, free T4, and you should ask for antibodies. So if you see that your free T4 is kind of okay, but your T3 isn't, that means you're not converting to the active form, which is crucial for your energy. So if that doesn't happen, some people then proceed to add synthetic T3, liothyronine, which is, it's a form, synthetic form of the T3 hormone, which may work quite well for some people. You need to dose it several times a day because the short life is very short. Its life is very short. Another form of thyroid hormone that people have traditionally used before there was synthetic hormone is desiccated animal thyroid. Now, the vegetarians won't love this, but it's basically made from dried, desiccated pig thyroid or bovine thyroid from cows. The composition of thyroid hormone is slightly different to the human, so it has a bit more T3, but it seems to work very well for a lot of people, including myself. So I've been taking it for about 12 years because my thyroid is basically atrophied to a state of non-existence. So I can't live without thyroid hormones, but T4 alone did totally not work for me. So this is a medication that was widely used. It was the only medication before there was synthetic thyroid hormone, and it was dosed until people lost their symptoms, until people became well. So there was no lab test. There was no, blood test saying, hey, you've got enough. But the good doctors would just dose until people became well. It tends to work for most people. However, it's a little bit more difficult to source. In Singapore, there's only a few doctors who prescribe it because there's brand names from the US, and you have to import it on a named patient basis. And then there are some OTC supplements that one could consider, which are not standardized though, but people also are quite happy with those hormones. And overall, there have been few studies done about these medications, but the few that are there show that the well-being is generally much better for that subset of people who just don't feel well on synthetic thyroxine. There is just this one subset of people who don't convert very well, and until today, we don't even know exactly all the hormones that the thyroid is making. So we are just giving one, regular medication is just one of those, which isn't even the active form, hoping it will convert. But the thyroid that we know produces T4, T3, T2, T1, calcitonin, and then there could be up to another 30 or so hormones or enzymes that we have not even discovered yet. So if you take the animal extract, actually you get everything. It may not be exactly as in the human form. It's a bit more tricky to work with it if you're just starting out, because if you have issues with your adrenals or you have nutrient deficiencies, it may not work well enough. So you need to address all those other causes as well. But I would say for those who feel unwell on synthetic medication, on the T4 alone, it's worth exploring it. But you must find a good doctor.
So thank you so much, Anke. It's been really eye-opening because a lot of these things are not taught to you in medical school, and a lot of doctors also don't impart this kind of knowledge to their patients who want to know more about their condition. So thank you so much for sharing so much of your knowledge. It's been great, and I hope we can probably talk on different subjects sometime soon.
Yeah, I'd be happy to. Thank you so much for having me.
Thank you so much. Bye.